Good evening. Good evening. I'm sorry. I think earlier I had the microphone up so close that it was becoming background noise. Well, I want to welcome you to this evening's show. Moshe Landman, candidate for the Green Party. We need a little music here. Tonight we're going to talk about U.S. healthcare. But we need a little music first. It gets you in a positive mood for a difficult topic. Well, let's talk about healthcare. That's a critical issue. The Green Party has a lot to say about healthcare. Let's read right from our position. The United States healthcare. America must have a universal healthcare system covering all citizens and residents from cradle to grave, including hospital, doctor, nursing, diagnostic, dental, vision, nutrition, and holistic medical care. Health is a right, not a privilege. That's big. And we will, in the end, save money and even have a healthier, more productive, and happier society. The Green Party supports single-payer universal health care and preventative care for all. We believe that healthcare is a right, not a privilege. Our current healthcare system lets tens of thousands of people die each year by excluding them from adequate care, while its exorbitant costs are crippling our economy. The United States is the only industrialized nation in the world without a national healthcare system. Under a universal, comprehensive, national, single-payer healthcare system, the administrative waste of private insurance corporations would be redirected to patient care. If the United States were to shift to a system of universal coverage and a single-payer plan, as in Canada and many European countries, the savings in administrative costs would be more than enough to offset the costs of additional care. Expenses for businesses currently providing coverage would be reduced, while state and local governments would pay less because they would receive reimbursement for services provided to the previously uninsured, and because public programs would cease to be the dumping ground for high-risk patients and those rejected by health maintenance organizations, HMOs, when they become disabled and unemployed. In addition, people would gain the peace of mind in knowing that they have the health care they need. No longer would people have to worry about the prospect of financial ruin if they become seriously ill, are laid off from their jobs, or are injured in an accident. The Green Party supports a wide range of health care services, including conventional medicine, as well as the teaching and funding and practice of complementary, integrative, and licensed alternative health care approaches. Greens recognize that our own health is also intimately tied to the health of our communities and the environment. To improve our own health, we must improve the quality of our air, water, and food, and the health of our workplaces, homes, and schools. So there's a lot to talk about there, right there, that we have covered. In the documents and evidence section of our site, we have an explanation of how we get to universal health care and how it will save us as many as 100,000 lives a year and $500 billion a year. Healthcare costs in America are exorbitant. We spend $12,318 per capita, per person on healthcare. The average around the world is $5,829. We're more than double. Germany, 7,300. Switzerland, Austria, Sweden, Netherlands, Canada, Australia, France. Look at this. Japan, 4,666. South Korea, 3,914. So our costs are out of control. We spent $4.1 trillion on healthcare, even in 2020. That has gone up 4.3. Hospital care is down 1.3 trillion. Physician services, almost 600 trillion. Clinical services, 220. Prescription drugs in the mid to high 300s. Other personal care, 609 billion. So the costs of healthcare have been rising from 5% of GDP to almost 20% of the gross domestic product. America's healthcare system is not working for anyone except the overpaid insurance and pharmaceutical executives and medical specialists. Those who can afford insurance and the companies paying all or part of the premiums are suffering. The U.S. federal government and the states are bearing the high costs of Medicare and Medicaid. Nearly Medicare and Medicaid, the budget items together are just They're nearly 1.8, trillion, 1.6 trillion dollars. Nearly 30 million Americans have no health insurance, 10% of the population, while 43% of adults are inadequately insured and are avoiding necessary treatment or ending up in emergency rooms with large bills leading to bankruptcy or left to the states to pay. We pay too much per capita on healthcare. A universal healthcare system, Medicare for all, can fix the system. We can provide full medical, including prescription drugs, dental, vision, and even long-term care coverage for every American and save money at the same time. And by dental, I even include your root canals, which, by the way, are a huge cost, and many people are stuck with the bills. How does universal healthcare system work? A single payer. There are three types of universal healthcare systems. The United Kingdom has a single payer system, free government provided healthcare paid for by income tax revenue. Every citizen has the same access to government owned services. Now, another option is mandatory insurance, government run health insurance fund financed by payroll tax on employers and or employees. Private doctors and hospitals provide the services. That's what Germany does. Then you have what's called a national health insurance. Every citizen pays into a national plan provided by a single insurance company, like in Canada, publicly funded and privately delivered. So that's what we're talking about here. There's Medicare for all. That's a U.S. president. That's what Bernie Sanders is proposing, to expand the current U.S. Medicare system to cover everyone. It would include more services such as dental, vision, and long-term care, as well as prescription drugs. It would eliminate copays and deductibles. We all know how terrible those are. And finance the program through a series of income and employer taxes and by closing certain loopholes. The other option is universal health coverage, UHC, ensures that every citizen has health insurance, financially protects them, and provides a standard set of benefits. Coverage can be achieved through mandatory social insurance programs such as public-private arrangements in Germany, government-run systems like Sweden's, or managed competition in private plans such as in the Netherlands. Supplemental private coverage can be purchased for services and procedures not covered under UHC. Then there's socialized medicine. The government owns and operates healthcare facilities, employs the healthcare providers, and pays for all healthcare services. The British National Health Service and the health systems in Spain and Cuba, as by the way, is very well known. They actually train doctors who go to South Africa and all around, even though their economy is way backwards, are examples of socialized medical systems. In the U.S., the Veterans Administration is a government-run socialized system. The government owns it, the hospitals, and the staff members are federal employees. So we talk about, you're so scared about socialized medicine when the whole Veterans Administration is socialized. Finally, you have single payer, a publicly financed national or state health insurance where one public entity, the government, collects all healthcare fees and pays for all healthcare costs. The system is intended to provide all citizens with high quality, comprehensive medical care and the freedom to choose providers. Delivery of care generally remains private. Canada, Norway, and Denmark are examples of these systems with single payer. In the U.S., Medicare is a single payer system. The government pays for approved services, but most practices in hospitals are privately owned. So in America right now, we have a disaster when it comes to the medical system. We're spending, you can please check Peter G. Peterson Foundation. I just posted it on Twitter today. Why are Americans paying more for healthcare? They're not getting better services. We still have one of the highest rates we have a low life expectancy below other countries at 77 years old, while many other countries are in the 80s. We are overweight and obese. Up to 70% of the people in America are overweight and obese versus 50 around in other countries. Infant mortality is still at 6, is higher, and diabetes per 100,000 person is still in the highest of all countries. A lot of this has to do with our diet, fast food industry, high fructose corn syrup, and all these products. Tons of preservatives in products. What people are eating too much. They're not working out. So we have a bad lifestyle. We were in the office sitting all day. I was there today myself. And why else is our healthcare costs going up? Well, we have an aging population. So that population is obviously much more. There are much more healthcare costs when it comes to the elderly, including long-term care and et cetera. So we have to figure out, because they're moving from 13 to 16%, as much as 20% of the population by 2030. And Medicare spending is expected to grow significantly from about 3% of GDP to 6%. And we have, they say, so much waste in the system, about as much as 25% waste even in the current system. But the main problem is here, the right wing, the Republicans don't like the idea. They want to keep it privatized. They don't like the idea of what's called socialized medicine. They're afraid. But they also understand the concept of taxes and the costs, and they don't want the taxes to go up. But there's no other choice. So, if we can show them and everyone a system that the Green Party has of universal health care, and that it works and it saves money, and that we can monitor and optimize it, then I think everyone will be happy. With doctors, instead of making $2 million a year for a neurosurgeon, they're going to make 300, 400,000 like other countries. That's how it's just going to be. They're going to have to work like the rest of us and create businesses on the side, maybe products, maybe consulting. But the way, essentially, they have a trust. The medicals, from the pharmaceutical executives to the specialists, the doctors, they have a monopoly. They charge whatever they want. It's not even them. It's the insurance companies that push up the prices as much as they can, and then they push out people with pre-existing conditions, and so they create, and they have people buy essentially, you have no choice. You're about to die, and you have a sickness. You need health care, so they've got everybody by the neck, and we have no choice. And the government is not doing anything, except for Medicaid for those with the lower income. At least that covers people, and then Medicare for the elderly. But we just need a universal coverage. This is ridiculous. And the profit taking by the insurance, by unfortunately the medical professionals themselves, and that's how it is. There's just too much money there. Otherwise, this system at 20% of GDP is again going to load up our debt, and we're going to continue to have higher interest costs, and our whole system will collapse because of healthcare. So we all work together, or again, if America tries to just let the 1% to 10%, the greedy, and amongst that 1 and 10% are many doctors who need to study this issue. If they believe in bodily health, then I believe that they should also understand financial health of the country. And if that should be part of their education. Every medical school should have financial, and not just personal finances, but government finance education. So that's why many people who have gotten a master's in public health can understand this and can maybe work with the system. But pocketing all this money, and then through their connections to the drug companies, it's basically a trust. It's basically a monopoly. It's just like Wall Street with the junk bonds and the private equity, etc. Special treatment for people with special placement. Anyway, that's our view on healthcare with the Green Party. We're running with the U.S. Senate, and we have a couple of opponents already who have stepped up, including David Trone, who owns Total Wines and More, which is a national total wine chain. He's done very well, made millions and millions of dollars. So you'll see his name everywhere. And hopefully we'll have an influence on him. And if you want, you can vote for us, and we can defeat him. But I've met him a few times. Nice guy. And he does care well, but you don't hear him too much in Congress. I'm not sure why you don't see his name. You don't see him very much. He does things in the low. Maybe he just wanted to be there with the money he has. But I'm sure he's a good guy. Have a wonderful evening. Thank you so much.